So the factors to be considered in the treatment of the deep bite. The deep bite are usually corrected by the intrusion of the anterior teeth or by extrusion of the posterior teeth. The orthodontist should decide which of the two modalities is indicated for the given patient. Okay, so there are certain factors that helps in deciding whether to intrude the anteriors or extrude the molars. So what are the factors that will help us to decide what to do? So the first is lip relationship. The patient with the deep bite who exhibits the shorter upper lip, gummy smile or excessive exposure of the upper lip should be treated by the intrusion of the anteriors. Okay, so here the picture is showing that this patient has the number D. The patient has the deep bite who exhibits the shorter upper lip, gummy smile. Here this patient should be treated by the intrusion of the anteriors. Now the secondly, in the patient exhibiting normal upper lip with the only 2 to 3 millimeter of the maxillary incisal is exposed, it is ideal to extrude the molars. Here in the case of figure B, it says is patient exhibiting the normal upper lip with the only 2 to 3 millimeter of the maxillary incisal is exposed. In such patients, it is ideal to extrude the molars. Now next, the interlabial gap should also be considered in planning the treatment of the deep bite. The patient who has the no interlabial gap should be treated by the extrusion of the molars. However, when the increased interlabial gap is present, the posterior should not be extruded, as it adversely affects the aesthetics by further increasing the interlabial gap. So now the next factors that we need to consider while treating the deep bite is the growth factor. The treatment of the deep overbites in the growing patients is considered to be easier to accomplish. Okay, it makes the treatment more easier. In addition, the results of the treatment are more stable in the presence of the growth. Now the third factors is consideration of the vertical facial relationship. The extrusion of one or more posterior teeth usually result in the downward and backward rotation of the mandible. Thus an increase in the anterior facial height occurs. This can be benefited in treating the skeletal deep bite with excessive horizontal growth and upward rotation of mandible. Now next is consideration of the interocclusal space. The average interocclusal space is 2 to 4 mm in the premolar region. The presence of increased interocclusal space is an indication that molars are not fully erupted. In such patients, the deep bite can be treated by the extrusion of the posterior teeth. Okay. Now, the orthodontist should not reduce a normal interocclusal clearance by the extrusion of the molars, as it can result in fatigue of the muscles of the mastication that gets stretched and predisposed to relapse. The presence of the normal interocclusal clearance is therefore an indication for the intrusion of the incisors rather than the eruption of the molars. So in the case of normal interocclusal clearance, there is indication of the intrusion of the incisor rather than the extrusion of the molars.